Hi, I'm Liz Henry on faculty with NAIOMT, and you may have seen some of my other videos on different peripheral nerve entrapments. The one I want to talk about now is the superior gluteal nerve. And if you have a patient that has diffuse buttock pain as part of their symptoms, whether or not you've found anything particularly in terms of the range of motion testing going on, they could have entrapment of this nerve. Now, there's no perfect nerve tension test for this nerve like there are in the other lower extremity tension tests. So this one is mainly found on palpation. So the superior gluteal nerve comes out of the sciatic notch along with the sciatic nerve. However, we know the sciatic nerve is quite large and travels down the leg. The superior gluteal nerve actually curves up and goes around, and it is located quite deeply between the glute minimus and glute medius, and it travels over laterally. And it is made up of roots L4, L5, and S1, and it innervates the glute med and men. It also sends a branch over to the TFL, and there's also an articular branch that goes to the hip joint. So how would you know if this nerve is a problem? You would find it on palpation. So the fibers of the glute max are coming down this way. So if you were to find a ropey-like sensation deep that is right along the path of the curve of the nerve, and it might even be quite sensitive, then that is your best indication that you have an issue here. So you would want to sink in quite deeply and palpate for that. And again, it would almost feel like a half-inch thick rope going along that side that your patient would not have on the other side. So once we find that, how would we treat it? Well, I start by doing what I call neurogenic massage, and you have to respect any sensitivity on your patient's part, but you could just lightly come in and free up that nerve along its path. Now, it is impossible to actually feel the nerve because it is quite deep and quite small, but what you can quite easily feel is the rope of tightness. So once you have freed up that nerve, then you can get your patient doing a bit of a slider. So if you'd like to learn more about treatment of the superior gluteal nerve, where you could literally get rid of your patient's pain in the butt, join me on a NAIOMT lower extremity course.